We're very pleased to announce this harm reduction intervention in collaboration with council members and Metro Parks. Harm reduction is really about meeting people where they are and providing them the resources to help keep them healthy and safe. And this initiative is no different than our other successful evidence-based harm reduction programs in that it provides people a safe way to dispose of used syringes. Now, while the primary population that we're aiming to serve with this is our residents who inject drugs, we know that there are incredible benefits for other residents as well. Residents who may be on insulin and need to dispose of their syringes from those injections, or people who are using the park and may come upon a syringe and want to dispose of it in an appropriate way. So we know these syringe disposal boxes work. We've successfully implemented 2 other boxes across the city, and today we're announcing the boxes in Boone Square Park, Shelby Park, and Portland Park. Each of the boxes has on it information about our syringe services and our harm reduction outreach services, as well as the website and a phone number for learning more about accessing harm reduction resources. And this safe disposal is something that has a strong evidence base. A 5-year study of a similar initiative in Montreal found a 98% reduction in syringes in the immediate vicinity of the boxes and a significant reduction in improperly disposed syringes up to 200 meters away. That's about 2 football fields away from the location of the box. So it's something that we feel strongly. Residents deserve a safe place to put their syringes, and this provides yet another option. People make choices based off of the choices that they have, and if people don't have a safe option, then they're more likely to use an unsafe option. It's my great pleasure to introduce some of our partners in this work. Something that we've learned over the past few years with the pandemic and other public health crises is that public health is everyone's business. So our department feels incredibly grateful to have such strong public health champions and such strong advocates for public health in our community, such as Metro Parks and council members. And it's my great honor. We're in Council District 5 in this park, one of 2 boxes that we were able to place in Council District 5. And it's my great honor to introduce the council member, Councilwoman Donna Purvis.
Thanks to everyone that is here today to witness this. I really want to echo some of the sentiments that Ben has already expressed, the need for this. I don't want the community to see this as being something negative, but something necessary. I've listened to my constituents be concerned as they bring their children to play in these neighborhood parks and been exposed to the dangers of hypodermic needles. And so I've been working with the health department for over a year to make sure that this is something that is possible to ensure safety. So, but as Ben said, it's also something that can be used for those that are diabetic, that have to take their insulin right away, that don't have anywhere to dispose of their needles. And so this is something great for them as well. So again, I don't want the community to look at this as something that's promoting drug use, but this is something that will ensure safety, and public safety is very, very important. And I think everyone should have the opportunity to come out and enjoy the parks without being in danger of being hurt or harmed. So thank you.
And also, I'd like to invite up our Director of Louisville Metro Parks and Recreation, Margaret Brosco, another leader and advocate for this initiative.
Thanks, Ben. Thanks, Councilwoman Purvis. It's great to be here. Also wanted to give a shout out to our other members of our team. So Assistant Directors Jason Canuel, Masude Ozorokola-Dwyer, and Ben Johnson are here, and then Morgan and John from our community engagement team. So thanks a lot. I know Masude and her teams worked really hard to make sure that this all became a reality. So Parks and Rec is really proud of the relationship that we have with public health and wellness. We share many of the same goals, working towards sustaining an environment and a lifestyle of physical and mental well-being. People really count on our public parks, so the safety of our park staff and our patrons is really critical. So when Public Health and Wellness reached out to our department and identified this need for syringe disposal boxes, we found that both the community groups and Metro Council members were really supportive of this idea. After meeting with our operations staff and discussing this idea with many neighborhood groups, churches, and other stakeholders, we began this process with public health and council in 3 parks. Now, this close partnership and vision of a healthier community, that's what brings us all together here today. And this isn't the first time that we're teaming up with public health either. You'll remember earlier this summer, we all worked together on a tick prevention identification program in 30 different sites. We wanted to make sure that the public was educated about tick-borne illnesses and identifying risks and areas where this was prevalent. They also provided Narcan training to our staff, and they also provide other critical support to educate our employees so that we can do better jobs when we're in the field. So we wanted to thank them for identifying this new opportunity so that we can work together once again to meet another community need. So when our staff encounters syringes in parks, they've been trained in proper disposal methods with the help of public health and wellness. But these boxes in 3 of our parks will actually reduce the amount of syringe encounters that take place by our staff and by patrons. And that's a huge win for the community. So thanks again for being here today.
Thank you, Director Brasco, and thank you all for being here. Just in closing, I'd like to reiterate, this is an evidence-based best practice for disposing of safer injection supplies. And once the syringes are placed in the box, it is impossible for somebody to remove those syringes unless it's the authorized disposal team. These boxes haven't been shown to increase substance use in the area or in communities they've been placed, and we hope that they are a great way for people to have a healthier choice. Thank you.